Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and this episode will be diving into a practice question involving radiography for pediatric hip pain. So the question is as follows. A clinician is evaluating a pediatric patient who present with complaints of hip pain. During chart review, the clinician sees that a frog leg lateral view radiograph has been performed and there is an abnormality involving the proximal femur. Which of the following diagnoses is most likely? Option A, slipped capital femoral epiphysis. Option B, congenital hip dysplasia. Option C, femoroacetabular impingement. And option D, pediatric septic arthritis. So let's take a second to think about that. And let's break this down and look at each option choice. So first, what do we know about a slipped capital femoral epiphysis or a SCFE? Now, this condition is commonly seen in what population? Yep, that's right, the adolescent population, especially during periods of rapid growth, such as puberty. Now, how do these patients present? They will present with hip, groin, thigh, and maybe even some knee pain, often associated with a limp. On imaging, especially on a frog leg lateral view, you'll see the displacement of the femoral head posteriorly and inferiorly relative to the neck, which is a key sign of a SCFE. It's like the ice cream slipping off this cone. So now option B, what do we know about congenital hip dysplasia? Well, this condition is commonly caught at what stage of life? It's caught in infancy, not adolescence, and it's often diagnosed with clinical screening tests. Think about those tests. If you said Barlow and Ortoloni, you are right. That is the clinical screening tests we use early on for diagnosis during infancy. It's not typically the cause of sudden hip pain in an older child, so we can cross off option B. Now we have option C, a femoral acetabular impingement, or FAI. Now, what population does this tend to affect? It tends to affect older adolescents and maybe even some young adults, especially oftentimes athletes. It's more of a chronic condition caused by abnormal contact between the femoral head and the acetabulum. Radiographic findings will look different. We'll be looking more for a cam or pincer lesions. So we're not really thinking option C would be the best option choice either. And now we have option D, our pediatric septic arthritis. Now this is a critical differential to keep in mind, especially if the child has a fever, elevated inflammatory markers, and inability to weight bear. Septic arthritis doesn't show up with a specific proximal femoral deformity on imaging. It's more about joint space changes or effusion and the clinical presentation to lead to a diagnosis of pediatric septic arthritis, oftentimes more acute and systemic in nature. So what's the most likely answer based on that presentation and imaging finding? That leads us to option A, that slipped capital femoral epiphysis or SCFE. Now remember, a SCFE is the most common hip disorder in adolescence, and it is a condition that can be easily missed if you're not thinking about it. Classic radiographic findings on that frog leg lateral view make the diagnosis more clear. So this is one you want to have on your radar. Some other things to keep in mind regarding our frog leg views is that this is the preferred view for femoral head and neck for diagnosis such as SCFEs in pediatric populations. We would not use a frog leg view for fractures due to increased torque on the femur. Now, our other radiographic view of the hip is our anterior or posterior view. This would be the preferred view for fractures, dislocations, bone lesions, degenerative diseases, or post-op exams. I hope you found this episode helpful, diving into some radiographic views for pediatric hip pain. Now here's a quote by Helen Hayes. "The expert in anything was once a beginner. Remember, every challenging case you study now is laying the foundation for the confident, capable clinician you're becoming. So keep showing up and keep staying curious. You are powerful, you are strong, you are a final frontier warrior, and you will pass." Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms, such as Facebook, Instagram, X, and TikTok. Till next time, have a great day and a powerful tomorrow.